The COVID-19 pandemic is challenging for all of us, but it's especially concerning for patients with cancer and chronic conditions and their families as well. We would like to provide insights that are useful to cope during these days. And this is the first in a series of discussions I will have with experts in the field of oncology to help the cancer community navigate through this situation. Today, I welcome Dr. Fatima Cardoso. Dr. Fatima Cardoso is a leading expert in breast cancer, and she's the director of the breast cancer unit of the Champalimaud Foundation in Lisbon. And I'm very, very happy, Fatima, that you took the time today. And I see you healthy, and I hope the same is true for your family and all your loved ones. I mean, Fatima, I think we all try to support the communities, try to support patients during these days. When you look, for example, at Novartis, we give our contribution in the form of donations, of funds, of medicines, of supplies, and we obviously are engaged in research activity to find treatments. But when I look at you, you are really, and countless other healthcare professionals, you are at the front lines. You are continuing to treat cancer patients. And I think we cannot thank you enough for all this dedication. And I'm really glad that you took the time. I mean, watching the news, I see quite some concerning news that some countries have postponed cancer treatments, that they postpone even surgeries. So I'm curious to hear, how is the situation in Portugal? How is it in your institute? And maybe as you're well connected, what do you hear from Europe? How is the situation?
Thank you. Thank you very much for the invitation. Thank you also for doing this, because I think it will be very useful for cancer patients particularly, but maybe it can also be useful for healthcare professionals in the field of oncology. So I think that perhaps my main message that I would like to convey is that it is very frightening for all of us, for patients, but also for healthcare professionals, to work under a pandemic situation. But it is crucial that people understand that no matter how frightening this virus is, the mortality rate is relatively low. And if we compare with the mortality rate of cancer, particularly if left untreated, so cancer that is not treated, the mortality rate is far, far bigger. And if we compare with the mortality rate of where I dedicate my life lately, which is advanced breast cancer, the mortality rate is 100% and very fast if we withhold treatment. So I think we all have to moderate our fears so that we take care of the pandemic. We do things in a different way, and we'll be discussing a little bit about that, but we don't stop treating our cancer patients. And also, for anyone out there that can be listening and has a suspicious symptom of breast or any other cancer, don't be afraid to look for medical advice. What we see here in Portugal, they are giving us as an example of the way we are handling the pandemic. But there is one very scary and disturbing news, is that the mortality rate of other things besides the COVID-19 is increasing. And we believe that it's because everybody and all the efforts are so focused on the virus that, for example, for heart attack and stroke, the first few hours is crucial. And if patients are not seeking immediately care and are not taken care immediately in those few hours, then the mortality and the morbidity increases a lot. And we also fear, not just here in Portugal, but all over the world, that once this pandemic is under control, we will see a lot of more advanced cancer cases, because people have not gone to seek medical attention during these months with fear of getting infected. So I think that perhaps the most important message of all is, please don't forget that there are many other diseases. Cancer is certainly one of the major ones, but cardiovascular and cerebrovascular diseases as well, and they kill much more than the virus.
And you mentioned that you apply maybe different ways now. So when you look at your daily routine, do you apply new ways like telemedicine, or I don't know, how you stay in touch with your patients? And maybe also, did you change your cancer treatment protocols or anything, any advice you could share also, how you dealing with this?
Sure. I think that there are certain guiding principles. So what is not urgent can be postponed. So for example, screening programs are on hold for the moment everywhere around the world. Follow-up exams and follow-up appointments are also either postponed or done by telemedicine, right? And what we are keeping is selecting those cases that are urgent or have a medium priority, and organize our workload according to the urgency of the treatment. And what guides the urgency is biology, because of course in the most aggressive tumors, inflammatory breast cancer, triple negative breast cancer, HER2 positive breast cancer, you have to act quickly, right? And then in the more indolent cancers, you may prescribe endocrine therapy and withhold more invasive procedures for a little bit longer. And then what we may call tumor burden. So both in the early setting, the more advanced stages, and also in the metastatic setting, those who have more burden of disease, more metastases, are of course more urgent to be treated. And finally, the other factor is the known clinical benefit of the intervention you are doing. So for example, a surgery for a breast cancer is highly effective. So we can only postpone in very limited circumstances. Like I was saying, patients that can start on neoadjuvant endocrine therapy and then wait for a better moment to be operated. Chemotherapy in the early setting for triple negative and HER2 positive is urgent. You have to do it, right? In those circumstances, in the early setting where we are in doubt if chemotherapy brings a lot of benefit, then our benefit risk balance is shifted a little bit now. And in doubtful cases, we probably don't go for chemotherapy and go for endocrine therapy, right? And in the metastatic setting, the same. Anti-HER2 treatments prolong substantial survival, so they are indispensable. In triple negative, you only have chemotherapy to propose mostly, but you can choose among the different chemotherapy. And that's the other message we're giving. There are many different types of chemotherapy. Some are more immunosuppressive than others. Some are oral. You don't need to come so often to the hospital. So in the metastatic setting, there's a lot of flexibility to avoid immunosuppressive treatments, to prefer oral treatments, and to decrease the visits to the hospital. In the early setting, which is a potentially curable setting, we tend to keep exactly the same protocols, but we try to avoid weekly schedules. And we use much more than usual growth factors to avoid febrile neutropenia. So we try to provide the best supportive care to be able to keep the treatments as close to the guidelines as possible. Because again, as I said in the beginning, if we don't treat properly and timely, the mortality is much higher. And in terms of radiation, more and more, what we call hypofractionation, meaning giving shorter number of sessions, is crucial, because the faster you do it, the less visits to the hospital.
And if patients have to undergo such a therapy, what do you then advise to them? What specific behavior or actions they need to consider then when they have to go through such a therapy?
Well, I think there are two points there. One, usually we advise people to keep their life as close to normal as possible. I think this is a major change now. We advise people who have to go through chemotherapy or other immunosuppressive agents to not to work unless you can do work at home, right? But not to go to work, not to go to shopping.
Yeah.
Please ask someone else in the family to do the grocery shopping, or use the ones that can bring things at home. If you need to go out, and when you need to go to the hospital or to the pharmacy, use a mask. It's indispensable to use a mask. And of course, all the recommendations of social distancing, even unfortunately inside our own homes. If your other family members are going out, you should keep away from them. And you know that Portuguese are a very touch and feel country and people, and we like to hug and to kiss, but this is not possible at this time. And we need to keep our distancing, because I think when we started this pandemic, what inside our breast unit we said is that if we, at the end of the pandemic, we would be able to treat everyone properly, and that nobody, either from our patients or from our health professional team, would die from the COVID infection, then we would have win this war.
Yeah. Yeah, and Fatima, another question, as you talk about the culture of the Portuguese, and there's many countries where, but also, where you just want to stay close, and the whole social distancing is a challenge for your mental health. And,
Yeah.
in addition, we know cancer patients, they go through quite some heavy, pressure mentally coping with such a disease. Do you have any support, or how do you help your patients to avoid depression or anxiety? Any strategies there?
So that's very important. And I have to tell you that all the psychologists kindly accepted to continue to do the appointments, and to do more appointments using any of these Skype or Zoom or whatever technology you may use, or even a simple phone that you can have a video call. And they have accepted to do that, and continue to provide psychological support for all the patients. And I think there are a lot of fears. And in the beginning of the pandemic, we were flooded with calls and emails of people who were just absolutely frightened. And perhaps it's also an opportunity to clarify a few things and say, for example, if you had breast cancer or another cancer, let's say if you are what we sometimes call a cancer survivor, or if you're just taking adjuvant endocrine therapy, your risk regarding COVID-19 is more or less the same as the other population. So don't be afraid, okay? This does not increase the fact that you had a medical condition, but you have recovered. You are not at increased risk. It's much worse, for example, for someone who has a chronic respiratory disease and is still suffering from that. Now, if you are currently ongoing treatment, yes, you are at an increased risk, in particular if you're taking immunosuppressive therapy. But for that, the most important thing is social distancing, wearing masks, and wash your hands all the time, disinfecting your hands. And if you do that, you will go through. And think about what I said in the beginning, the risk of having or either dying or having severe consequences is worse with the cancer than with the virus. So that's what has to keep your mind focused. And it will be few difficult months, particularly difficult for those who have to go through treatment during these months. But I'm sure that you will come through at the end with a good treatment and overcome both diseases.
So thank you so much. I can only say, hearing you, that inspires me and give me a lot of hope. I agree. I think we will get through this crisis and we will come out much stronger than we were before. So thank you so much.
Thank
and
you.
I hope we could provide some useful insights for patients that go through that.
Thank you. Stay safe.
You too. Stay safe.